obviously, we're here to talk about COVID and kids as school starts just here in August. Did you see the comment that the American Academy of Pediatrics put out yesterday,
I
suggesting
did. I
that
did.
kids 2 and up wear a mask? First, let's get your take on that.
Okay. Okay. I am fully vaccinated as well as all of my family members that are eligible. And I do believe that masks are saving lives. Yes.
And
So,
so, go ahead.
no, so I am definitely a proponent of mask wearing, especially in large crowds.
And so, as far as it goes for schools, ages 2 and up, right now we're seeing a rise in a lot of cases with this Delta variant
Yes.
impacting younger children. What's your opinion on that?
So I have a child that is within that age group. And I have definitely seen a rise in cases, both on the inpatient side as well as the outpatient and community side. So I am very alarmed by the numbers and very concerned.
And so, what exactly are you seeing as far as numbers on the patient side? Are you guys seeing a lot of kids come in with like different symptoms, or what exactly are you seeing?
Right. Well, on the inpatient side, we tend to see those who are hit hardest with the COVID-19 virus. So we see patients that have severe sequelae from the infection. When they come to the hospital side from the intensive care unit, we're often caring for them when they're post the most difficult phase of their illness. But lots of children have upper respiratory symptoms, fever, loss of taste and smells, the common disease manifestations that we see in the community for adults.
1 second, because someone's about to come in the door. It'll probably mess up our recording here.
Okay.
Um, just gonna mute it. And so, so what's your take as far as seeing a rise in those cases in kids that are who can't get the vaccine?
Right. Well, for a long time, we've been concerned that children, especially our younger children, are more so carriers than infected by the virus. But I think the concern now is that with the Delta variant, our children may start to be much more symptomatic than they were this time last year. And so, we're really concerned about their disease state and how their bodies will be able to handle the virus if they contract.
And so I think it's just become like a big debate because you have some states like Texas and Arkansas who say like schools can't mandate masks, but then here in Louisiana, we're kind of like leaving it up to the schools. From us speaking from a doctor's standpoint, what's your opinion on should masks be worn in school, or what's your take on mask overall?
I think that masks definitely protect. We saw a strong decrease in the number of respiratory viruses that were spread this past winter, and I think a lot of that did have to do with mask wearing. The ages, 12 and under, they're a vulnerable population, and the argument from the American Academy of Pediatrics that wearing masks in schools will help lessen the risk of transmission and infectivity for those, I think is a very strong argument. A lot of schools are discussing it now in our area. The Cattle Commission is also discussing whether or not to re-implement a mask mandate in our public gatherings. So I think that people who really take the virus seriously and understand what it can do for our children are considering re-implementing the mask mandate. And I will most often go along with what the American Academy of Pediatrics suggests.
And for kids 2 and up, how do you get them to kind of stay protected and keep the mask on? Kids that age, they tend to take it off.
Well, it's very interesting because, like I said, I have a younger daughter, and children do very well. They really listen to instruction, and they follow instruction well. So oftentimes if the teachers are wearing masks, the administrators are wearing masks, they make it a part of their daily routine. They do extremely well. My daughter wore her mask every day in elementary school, and she would even remind me and remind her dad to make sure that we had ours on as well. So I think that if it becomes the standard in our school system again, that our children will definitely comply.
And so, overall, how important is it for those kids who can get the vaccine to get the vaccine? Because wouldn't that help those younger ones who can't?
Oh, absolutely. The more vaccinated our population is, the closer we will get to herd immunity. I know we have pushed for at least 70% full vaccination in our community, and I hope that we continue to do so. What we have seen thus far is there are very few documented sequelae from the vaccine, and from a risk benefit perspective, the benefit of the vaccine clearly outweighs the risk. So I would encourage everyone who has an opportunity to be vaccinated to be vaccinated.
And I'm just gonna switch our view real fast. And from a doctor's standpoint, how does it feel seeing that we're kind of back in the same spot that we were last year, having this debate on whether kids should wear masks in school?
Question.
You're fine. As a doctor, how does it feel being back in the same spot where we're kind of having the discussion on whether kids should wear masks in schools or not?
Initially I was a little discouraged because I definitely am an optimistic person, and I felt that with the numbers decreasing, that we were really at a turning point with this virus. So I must admit, for the last few weeks, I've been discouraged that our numbers are increasing and that we are starting to see more and more people coming into the emergency room and the hospital with the COVID virus. I'm very hopeful that people will listen to the messaging that's going out, the correct messaging, and understand that we all need to be vaccinated, and that vaccinations save lives and allow us to congregate as a community again.
Oops. Last question here. You said your daughter's in elementary school. So, what if her school doesn't mandate masks? What will you tell your daughter to do, and how important is it? What are you hoping that the school does?
Well, I think that's one of those difficult questions as not only a parent, but a healthcare provider, because if no one else in the classroom is wearing masks, it's really difficult to mitigate her mask wearing. So I encourage her when we're out in public together to wear her mask, as I do. My older daughter will be starting college, and all of the records for her admission ask that she have her vaccine. And so she's been vaccinated. So I would strongly encourage her to do so if it is not mandated at her school. But as we know, children, they do what others do, and I think it will be more difficult if it is not mandated.
Alrighty, and is there anything else that you'd like to add here?
Well, um, yeah, I just would encourage everyone, please read, um, do your research, talk to your healthcare provider. All three of the available vaccines are here in our area. If you only want one shot, if you want to do the 2-dose vaccine, I would just encourage everyone to get vaccinated, because we can see what happens to those who are not vaccinated. They're the ones in the hospital, they're the ones on the ventilator, they're the ones who have fallen seriously ill to this virus most recently. And so I just want to encourage everyone to get vaccinated.
Alrighty, and thank you so much.
Thank you. It was good to see you.
I know, nice to meet you.
Nice
Hopefully
to
we
meet
get to
you.
do this again.
Absolutely. All right.
Okay.
Have a really great day.
You too. Bye bye.
Okay. Bye-bye.